Hi, good morning, everyone. Welcome to 95th session for International Weekly Meeting in association with Samao. Uh, we are we had a last week meeting with WHO, and there were a lot of important facts and figures were being shown. This week we are meeting and getting an update from all the Samao countries and all the international national medical associations of the world who are a part of this forum. We have a COVID update. So let's start with South Africa. Akhtar, you would like to give an update? Dr. Akhtar Hussain.
Yes, thank you, Sharad. Thank you very much. Good morning again to everybody. In South Africa's situation is very much improved, especially last week and this week. Numbers are almost going down. It's varying from 3,000 to 3,700, and the recovery rate is almost 95.5%. Our death last week around 130, 133. We also got at the moment active cases 6,700 plus. Total tested of COVID-19 in South Africa was 22 million, and the positive came out 3.5 million. Our hospital admission, no, our positivity rate is also gone down. In the beginning, it was 30, 38, then came to 20. Now this week is around 7.5 to 8.2. Our hospitalization, especially ICU and high cares, are empty. We have 666 hospitals around the country. 6,284 patients was hospitalized. Out of that, 500, around 500 were in ICU, 243 were ventilated. And those are mostly unvaccinated people end up in ICU. There are few cases also vaccinated, double dose breakthrough infection they had, but the comorbidity, everyone had a comorbidity. Recently, I had a patient admitted with the headache, severe headache. Then he developed the COVID-19. The results and CT MRI came up. He had a pituitary tumor. Then he went blind and all the complication of Cushing syndrome. So one of our previous speaker from New Delhi, I like her statement. She said people are not dying with COVID. People are dying with COVID. That is very true. They got other cause of death, but same time they have a COVID positive. So that is the overall situation. Schools open up in South Africa. Above 12 years old, vaccination numbers are improving, but the teachers are same problems. Group of teachers don't want to get vaccination. They are going to the court order CCMA. And the government was giving grant for COVID grant. Now they want to stop. So there are a lot of unhappiness within the unemployed people. Business are recovering very slowly. The borders are open now, especially international borders are open. The only mixed messages are coming from our world leader, especially Boris Johnson. He announced very prematurely to scrap COVID-19 rules and regulation. I was just checking, the British police also got a case against Boris Johnson because he was having a birthday celebration with the 40 people in 10 Downing Street. So I'm interested to see his case, how far they are going. So this is the situation overall. We have been working very hard to implement and live with the COVID. Now some scientists, some political leaders, they are talking no need for masks. Masks never prevent anything. And vaccination is also controversial again. So people, evidence-based, Scientists did work very hard to control this COVID, but now all of a sudden, the whole mood is changing. Thank you, Saurabh.
Thank you, Dr. Akhtar. That was a good update. Can I invite Dr. Benito? Hi, welcome, Dr. Chong.
Yes, good morning.
Good morning.
It's already afternoon here in the Philippines. It's 12:30. Based on our record yesterday, we have a new case. Unlike in the previous weeks, starting our cases of COVID-19 due to Omicron increase after the holidays, after the Christmas and New Year's holidays. Then the start of January, we had starting to have 5,000 plus cases. Then last week, we have the highest cases with almost 36,000 per day new cases. But yesterday, there was a decrease in cases, 18,638 new cases, death 68, with active percentage of 6.6 active cases, numbering of 231,658, and total affected Filipinos with COVID is 3.2 million, with a death rate of 1.53, with a total of 53,801. Then we will start vaccinating our children 5 to 11 years old, numbering 12 to 13 million, and we have a total fully vaccinated persons of 60 million. Then we have first dose of 55 million, and we are also starting to give boosters to the A1, the healthcare workers, A2, the persons with comorbidity, and the senior citizens. Then we have almost 50 million to be vaccinated more. And we had a problem in our bicameral, the Congress and the Senate, regarding they are questioning our local food and drug administrator, and it's in the chat box, and our Department of Health regarding the use of ivermectin in the prevention of COVID-19, and the Philippine Medical Association supports the decision of our infectious disease specialists, the society, together with the WHO declaration and our DOH and FDA. Is there any consensus in our CMAO on the use of ivermectin so that we can issue a statement?
Dr. Chong, answer that question. Dr. Chong, is there any consensus statement for ivermectin in the use for CMAO?
Just give me a minute, Sarah.
Okay.
Hang on. Okay. I think it's just so far, if we are not mistaken, it's just in the context of clinical trial.
Yes, I agree, Saurabh, with Dr. Chong. The only place is allowing evidence-based research and clinical follow-up. There are not enough data, whether it's UK or Bangladesh or India, Pakistan. This is the backdoor treatment was given. There are no proper clinical guideline doses because it was used for animals, and the doses for human beings are totally different. And even the complication, the ivermectin, there is an ivermectin promoting group, activists, they've been promoting. If this drug was so good, why it was in a black market? Why it was not approved by the federal and drug and other authority of individual country? In South Africa, they were selling on the street during the phase 1 and phase 2 COVID one tablet, 1,000 rand, that is about 10,000 rupees, something like that. So I think we don't have any proof, enough proof. There's a professor from UK, he was presenting his paper. I attended that meeting. He couldn't show any follow-up of the patient's clinical trial outcome. So I think this drug need to be reconsidered properly till the scientific evidence-based results come out. It can't be preventive drug. There are no preventive drug for COVID-19. Thank you.
Also, there is an article which I can send in the group, which is by FDA. It's on the FDA website, where it says why you should not prevent use of ivermectin to treat this. And they are like, here is what all you need to know about ivermectin. So I think people can read that article. I think it is a very good article.
Can we issue a statement or request the WMA to issue a statement? Because there are proponents of ivermectin, and most of them are doctors also.
So you want the
hard.
world?
Yeah,
WMA
it's very hard. The situation here is very hard.
I think it's not.
Regarding the use. Even some of the doctors gave their colleagues with the sample of the drug.
Yeah, I think even in Singapore, right, we have a bunch of doctors who are quite anti-vax, and they've been promoting ivermectin. But honestly, there's very little we can do about this group of people, and it's a very tough situation. I think in every country there's going to be some opposition to vaccines, and I always find that this anti-vax group is they all have their own agenda. Each anti-vax person is different from the other, if you know what I mean. Every person has his own agenda. So it's a heterogeneous group. It's not a homogeneous group. It's not like a faith or a religion where they all believe in one thing. Actually, all of them have a slightly different agenda, each individual. And then they band together under on a bandwagon. But the reality is that they are a very heterogeneous group of people. I believe, that's what I believe. Singapore government is very, very, very fierce. Recently, we exercised the penal code against one doctor who had falsified vaccination records for an anti-vaxxer. So the police arrested him under penal code, and now they've upgraded the charges, and the maximum jail sentence for the offense is somewhere in the region of 20 years.
Oh.
I mean, they won't jail him for 20 years, but the seriousness of the situation is dire. So
Dr. Chong, are you saying that not everybody has a compulsion to take vaccine if they're in a medical profession and they can visit a hospital?
Okay, so we make life very difficult in Singapore for people who do not want to be vaccinated. We have what we call vaccine differentiation measures. So, for example, they can't go to malls, they can't go to this, they can't go to that. There's a lot of impediments. It's a kind of like they're making life difficult for you if you don't get vaccinated.
But how do you check that? Like, if you go to a mall, you can't see the statement. Like, you can't see a certificate for everyone, right? Who's visiting the mall?
Oh no. We are all on our phone. We get the vaccination status on the phone. So and when you check in, when you use technology, you check in, it's very obvious if you are allowed or not. And we also have labor law now. They've enacted an act in Singapore where if you refuse to be vaccinated, your boss can terminate you from your job. So it goes all the way. I mean, they're very draconian about it. So, and but even despite that, we have about 38,000 seniors who refuse to be vaccinated. And of course, they are the sword of Damocles hanging over our heads. 38,000 of them can swarm our ICU. So that's the difficulty we're having in Singapore right now. But as it stands, 91% of the population is vaccinated. And of course, we've started vaccinating school children as well. So, but nevertheless, even with all these vaccine differentiation measures, there's always a hardcore group that refuses to budge, and including some doctors. So it is what it is, right? It's a democracy. I hope that was useful. I don't know whether we can issue a statement on ivermectin. Right now, I think FDA has come out strongly against it. I remember Dr. Swaminathan the other day said there's a work group looking at ivermectin too, right? Yeah. In the WHO, and fluvoxamine. I remember Feverin, the antidepressant. I remember her mentioning that. So
yeah.
Maybe we can look at the WHO website for something on ivermectin, whether they have something. Later on,
I can send an email to her asking like if there is anyone who can provide this information for this group. We can do that as well.
Yeah, that's right. Thank you.
Thank you, Dr. Benito from Philippines. Can I invite Dr. Pillai from India to give an update? Thank you, Dr. Pillai, for joining.
Thank you. Indian situation definitely is improving. There seems to be a flattening of the curve. Yesterday, we had logged 2.35 lakhs of cases, but still it is 6% less than the previous day. And definite flattening of the curve we are seeing, particularly in the north and northeastern states. Numbers are fast coming down. South still, the number is there, but then even there, a flattening definitely we are able to see. And the test positivity rate is about 10%. Of course, it is much variable. Down south, it is almost 50%, but on an average, it is 10% test positivity rate. Then both the vaccines, Covishield, AstraZeneca, and Covaxin, which was in the emergency use category, now full permission has been granted by the Drug Control of India. So that again is a boost. As for vaccination, almost 95% of the population, eligible population, have received the first dose, and 74% of eligible population has received the second dose. So that way, it is a tremendous achievement for a country with a population of 130 crores. This much of people have been vaccinated. Then, of course, adolescent vaccination, that is 14 to 18 age group, definitely is picking up, and the number of people vaccinated is increasing. And then our ratio is now about 1.6, which has definitely come down from what it was previously. Now there is no activities are normally going on, except of course you had to compulsory wear the mask and hand washing, sanitization, and physical distancing. So crowd management is what is given more importance now. The police and other forces are strictly sort of monitoring it, and punitive actions are taken against those who violate it. And for functions, 50 to 100 people are allowed. We have categorized the intensity of the problem on the basis of hospital admission. If the ICU admission and hospital admission, how much it is, on that basis, 3 categories, the zone has been divided, category 1, 2, 3, and depending upon that, the crowd management, the number of people who can attend functions also has been laid out. And the sheet anchor of management definitely continues to be monoclonal antibodies, although there are reports that Omicron is sensitive and other reports that it is not, but still that continues to be the sheet anchor of treatment, and the results definitely are very good. the mortality rate, in spite of increase in the number of cases, has not gone up, which is definitely something of relief. And now from hospital and tertiary care, the attention now is at the primary care, because majority of the patients with Omicron do not have severe symptoms. So the stress is more on the primary care, and even locally, COVID first line treatment centers are opened up, where the isolation and minimum drugs are being given. And the fear complex definitely is coming down, but the strictness and alertness the government and the health officials are emphasizing on. So this is in general the scenario in India, and the Delta used to be the predominant one, and now of course it varies from 90% in states where there is a high number of cases to 60%, particularly in the north. So gradually the Delta is being replaced by Omicron. The studies also show that the antibody reaction to Omicron definitely is a deterrent for Delta variant infection. So Delta variant is definitely coming down. And although the reported number of cases seems to be about 2.35 lakhs, we definitely know that the real number may be even 4 times more, because most of them are asymptomatic or mild symptomatic, particularly of the upper respiratory tract. Headache seems to be a predominant feature of Omicron infection, and fever definitely is there, and upper respiratory infection, sore throat also is definitely there. So headache is one thing which stands out as a symptom for Omicron in our region. So this is in brief the scenario unfolding in India, and definitely a flattening of the curve seems to be there, and maybe in 1 month it may be getting under control. But lot of contradictory informations world over is coming in. Certain countries, as all of us know, don't even stress on mask wearing or social distancing. Every facility is just opened up. This definitely causes a lot of confusion among the public, whether all these restrictions are really necessary or not. And such things definitely are, even on vaccination, some very, very rare reports that it is harmful. And in the mRNA vaccine, the remnants of the vaccine are even found in lymph nodes maybe after 6 months. So such discouraging reports definitely are flooded, and the health workers and medical profession definitely is countering those things. And the national policy is that vaccination has to continue, and definitely vaccination has definitely helped in reducing mortality, hospital administration, and severity of infection. Thank you.
Thank you, Dr. Pillai. Can I invite Dr. Marie from Japan?
Thank you, Sabra. And in Japan, the number of the infected people has reached a new record of 80,000, but there are still very few deaths. The number of people needing ventilation is slowly increasing, and infections among children are on the rise. Booster vaccination have made little progress, but hospitalization hospitalization rates are low among the elderly who have received the booster shot. Thank you.
Thank you so much. Can I invite Dr. Elvin from Hong Kong? Dr. Elvin?
Hello, good afternoon. This is Alvin from Hong Kong. So, in Hong Kong, the Omicron had caused the fifth wave in Hong Kong, and every day there will be about more than 100 cases confirmed. So, although it's not really exponentially increasing, but for the 100 cases or more confirmed every day, that had already caused a lot of concern from the government, and all the citizens are really upset by the increased restrictions and the rules approaching the Lunar Chinese New Year, you know. And first of all, the schools, the primary schools and the kindergartens and the secondary schools are all closed earlier than about 2 weeks before the Lunar New Year. And the primary schools probably, the primary schools will be now closed tentatively even until the 21st of February. And the primary schools may only resume full-day in-person classes if more than 70% of the students had at least one dose of the BioNTech vaccine or 2 doses of Sinovac, all right? So the teachers are all vaccinated, probably more than 95%. Those who don't get vaccinated must have a certificate from the doctors who had examined them and said that they are not fit for vaccination medically. And then they had to go for testing every 3 days. Every 3 days. Okay. So this is sort of the vaccine passport, something like that. And in fact, the government had also announced that all the government departments would also require vaccination records. If not, the staff could not go to work there. And of course, this would jeopardize their career. And so we had closed all the restaurants after 6 p.m. and all the gyms, the sports centers, beauty parlors, all banquets, and even church gatherings are not allowed. They're all closed. So the Omicron wave had caused a lot of burdens, economical cessation, and also psychological burdens without family gatherings in the Chinese New Year. So, however, with such draconian measures, some people are still very resistant, and they are anti-vaccinist. All right. So now the vaccination update in Hong Kong. Let me see. 79% had the first dose. 71% for the second dose. Only 15% with the third dose. And that age group specifically, the over 80 years of age, with only 28% vaccinated. Those over 70 years of age, only about 60% vaccinated. And for the 11 to 18 adolescent group, is only 60%. And for the 5 to 11-year age group, it's only just started last week, and it's only 2.2%. Well, of course, because the schools are all closed, and there could not be mass vaccination programs. And the parents are, of course, hesitant because they don't know about the possibility of long-term side effects for the vaccination. Of course, they could still have the choice whether you give a Sinovac vaccine, the CoronaVac, or the BioNTech vaccine to these children. Anyway, theoretically, our scientific group, the experts committee, advised that the coronavac or the killed virus vaccine from China, mainland China, could be vaccinated to the age group down to 3 years of age. But the government now only allow vaccination from 5 years onward. And for the BioNTech, we don't have the pediatric formulation. So not like Singapore, they got the pediatric formulation from perhaps Pfizer. We didn't get the pediatric formulation from BioNTech. Anyway, we will now give the 5 to 11 years age group with the adult formulation, but diluted 1/3 of that. And this is used as off-label use for the adult vaccine in the children's age group. But anyway, so that's the update in Hong Kong. But of course, as expected, no mortality from the Omicron group yet. But we see that there are many hidden chains of spread of Omicron in the community. And because there are many cases of unknown origin. And that's why the government keep it very high-geared and draconian in getting the measures. But basically, many or more and more doctors and scientists don't believe that we could really have the zero tolerance achieved. After all, after almost 100 days of zero cases in Hong Kong, all of a sudden the Omicron emerged. And then even if we could achieve zero case sometime, but anytime there could be cases coming up again, just like in the past we have failed to have achieved the travel bubble between Hong Kong and Singapore. Every time we want to implement, then there are the outbursts of some cases in either places. So I guess that's the same thing that would happen between Hong Kong and mainland China. Even in China, there are cases coming out every day. So we just hope for the best. So in that case, that means perhaps the authorities and the experts are coming close to some point that they have to decide whether it's still aiming for zero tolerance or will adopt the policy of coexistence with the virus and then with other measures like everywhere in the world other than China and New Zealand and Hong Kong implementing. So that's all from Hong Kong. Thank you very much.
Thank you, Alvin. Can I invite Pakistan? Dr. Salma, Dr. Sajjad.
Okay, Saurabh, thank you very much. I think Dr. Salma is here. Then
Dr. Sajjad, you're breaking up. We can't hear you.
Excuse me, did you say Salma?
Yeah, Dr. Salma, if you can give an update. Dr. Sajjad, your network is bad. I think you can reconnect. Dr. Salma, can you give an update of Pakistan followed by Dr. Sajjad then?
Good morning from Pakistan. The thing is that the data that I have, first of all, I want to shed some light on ivermectin. There's Dr. Mubin Sayed, and he's done a lot of work on ivermectin. If we can invite them on this platform sometime, he'll clear this ivermectin issue. The other thing that I wanted to say was this fifth wave of Omicron, which is the fifth wave in Pakistan, it's going very high. And today when I was looking up the net, it is about more than 8,000 people infected, nearing 8,000, and the deaths in the last 24 hours were 27. So the death rate is lower, but the people infected is very, very high. And the vaccinated that have been dispensed so far is about 17 crores and 40 lakhs, which is, if we divide it by two, like 2 doses to one person, so literally about to every 2.5 person in Pakistan, one person has been vaccinated, which is good for a backward country like ours, where people are not really observing SOPs. So I hope to God we flatten this wave and everybody comes out of it. So it is more infectious, but it is less deadly, because during the Delta phase, we used to have 200 and 250 plus deaths every day. I hope to God it goes down. All the best. Thank you.
Okay, Swarab,
Doc-
can my voice is clear now? I just want to add something.
Yeah.
Okay, thank you very much. Actually, just I want to add Dr. Salma's very precisely mention about the situation in Pakistan. But the situation is, everything is open. The every business, schools, restaurant, the marriage hall, everything is working. Even the government has given some imposed ban or limitation for their work. But the unfortunate situation is that nobody is following the SOPs or the notice or the order of the government. Or the situation is very serious in future, maybe, God forbid. But the point is that people are not following the SOPs. My questions or suggestion that this is what, because the viral videos about we are talking about in the beginning of the session, that there are the videos and the scientists and the doctors are mentioning that there is a lot of hazards in vaccinations and using the mask. So my suggestion is, can this on CMO platform we can just give a press release for public awareness whether this is a very important issues to have the vaccination everybody. As soon as the vaccination is completed, the variant will be stopped. So this is my suggestion. What is the other August people are the view of my suggestion? So this is, I think it is not from the CMO platform, but also from the WMA platform to give the information that the vaccine is very genuine, get vaccinated, and as well as the WHO also should give a campaign or give the actual picture of the situation. So this is my humble request. Thank you very much, sir.
Thank you, Dr. Sajjad, for feedback. Dr. Bukhari, would you like to add something? You were saying something?
Yeah, thank you very much. Only I want to add one thing. The people were discussing about ivermectin in our university, UHS, and so many other places. We conducted the research and we found we have a lot of papers published. We found that no doubt it is a political thing. It has been politicized, but the ivermectin was used in prophylactic, and also its effects is better in if we use prophylactically as compared to if we use as a therapeutic. One thing. Second thing is that the ethics of the vaccine. No doubt, vaccine is a drug, and it is, I think, no doubt, very important that everybody should use the vaccine. But we cannot bound the people who are anti-vaxxers. So ethically, morally, we are bound, but ethically, we cannot bound the people to use the mask or people to use the vaccine. But literally, as a doctor, as a scientist, as a human being, we can teach them politely that the vaccine is very important And the SOPs of the using the mask is very important. That is why in every country you will find the people that you can convince politely. Thank you very much. This was my suggestion. And one question from the Indian peoples, my brothers, that we are hearing about a variant, that is sub-variant of Omicron, that is called BA2.2. And what can you update us? What about this new sub-variant of Omicron? Thank you so much.
Dr. Pillai, would you like to add anything on it? Anyone has an update on this, the sub-variant?
Okay, in Singapore, we've discovered 48 local cases of BA2 and 150 cases of imported cases of BA2. Of course, the unique signature on the Thermo Fisher kit is gone. 85 mutations versus 60 mutations for the original BA1. The Thermo Fisher kit can't detect the Omicron. You know, there's a unique signature, so that's gone with the BA2. Yeah, that's all we have for the time being. But we don't have anything clinically to add on BA2, meaning we don't see any differentials so far.
Yeah, to add on to this, more than the variant, what is circulating in the medical area is that neo-COVID, which was more or less discovered in 2014 or 12, which mainly is seen in the bats. There can be a propensity for this organism to spread to humans, and some debate is going on that issue, and the WHO has come out with a statement that better not to create a fear complex on this issue, because the possibility of further mutation and human infection definitely is very, very remote. So that is another thing that is circulating.
If I'm not wrong, neo-COVID is also found in the bats in South Africa. So if Dr. Akhtar has any update on it, it would be helpful. Otherwise, we can talk about this next week.
Yeah, no, we will discuss next week.
Okay, perfect.
Dr. Surab, because this is a big topic, I think keep it in the next week.
Yeah, so we'll keep it for next week. And so who else is left now for the update? Oh, obviously, our chair. He missed out. Dr. Chong, update from Singapore.
We're hitting about 5,500 cases a day as of yesterday. 3 deaths yesterday as well. So Omicron is big numbers. We have 333,000 cases so far to date for over the last 2 years, 850 deaths. What's interesting is children. For Alvin, I think he'll be interested. We have the figure is 14,380 children were sick with COVID from October. And of those 14,380, 4 were in ICU. All right, so we have 4 in ICU. 15 had MISC, 15. So that's the interesting thing. This figure is now updated to 17,699. 17,699 kids have been hospitalized in Singapore. 2,586 were hospitalized. All right, so this is the latest figure, but the previous figure I quoted you was about a couple of weeks ago. 14,380 for ICU, 15 MISC. So fortunately, no mortalities so far. Now, vaccination-wise, just to update Alvin's request previously, we have done about 140,000 children vaccinated to date. Quite a number on the second dose already. and we have no major side effects so far with the 10 microgram dose for those aged 5 to 11 years old. Alvin, was that useful?
Yeah, thank you very much, Chair. You said that for the 17,699 kids infected, 2,500.
2586 hospitalized. 2586.
2586. So
that's the
not a
latest
high
figure.
percentage.
That's the latest figure. But for the ICU and the MISC, it was 1430, 4 ICU and 15 MISC.
Yeah. So just for interest's sake, are they of Indian ethnic group or Malay ethnic group or Chinese or Caucasian?
No statistics available, but I can ask my pediatrician's colleague whether there's any differential in the racial groups.
Yeah, because in Hong Kong, we only have 2 cases of MISC so far. One is a Russian, another is an Indian.
Okay.
Yeah, Russian and Indian. So I just
so you want to find out whether the MISC distribution?
Yeah.
Okay, I'll find out.
Yes. Because in Great Britain, the GOS studies, they have found that out of their hundreds of MISC children, most of them are from African descent.
Oh.
And then the second rank is the South Asian ones, not anyone from East Asia. I mean the not that many Caucasians as compared to the African descent. That's what they said. But then it's interesting. I just wonder, of course, there must be genetic differences to explain it. But by the way, in Hong Kong, there is a very controversial act. That is, we had Delta strains isolated from the hamster, the guinea pigs, and then the government had culled 2,000 pets like that, all the hamsters, the guinea pigs. And of course, that saddened many of our citizens, of our adolescents and children. And interestingly, there are more than a dozen of citizens infected with Delta strains, supposedly infected by these pets. And so, but still, the veterinarians, they opposed and strongly condemned the government's action to cull all these pets. Well, of course, they said it's different from minks, because mink farms in Europe, they are culled because they are animals bred to produce something. They are not pets. The difference is now Hong Kong government is culling all the such pets. They want the citizens to surrender their pets to the government to be culled. So euthanized anyway. So, but I think it's very controversial. But anyway, even for those people infected by the Delta strains from these pets, they are not serious, thank God. Anyway, thank you very much, Mr. Dr. Chong.
Welcome. So that's for Singapore, and finally we've hit 91%. We've hit 91% vaccination rates, and 56% of the population have received boosters. So that's the last bit. So thank you very much.
Okay, excellent. So anyone else who has left for the update? I don't think everybody is covered, right? So we will close the meeting early, and anyone else has to say anything before we can shut down? Okay, so Dr. Chong will close the meeting this week. So yeah, go ahead.
I'd like to wish everybody a happy Lunar New Year. We're having the Lunar New Year on Monday, Monday, New Year's Eve for us. So everybody, happy Lunar New Year. And, you know, I look forward to seeing everybody again next week.
So Dr. Chong, with this note, I would like to understand how much virus, like how much like celebration is going to happen, and are there restrictions there?
For sure, there will be restrictions because the Singapore government is very careful about super spreader event. But we are allowed to only have 5 persons at dinner, at a dinner table. So I have 14 of us. So we have booked 3 tables in a restaurant. Shh, don't tell anyone. But we won't mix with each other. We'll just all sit together.
So can I suggest like all 3 tables are having a Zoom laptop in front so that you can connect with each other?
I suppose.
Dr. Chong, kindly.
As long as my
Dr. Chong,
all of us together, I think they're happy.
Okay, Chong, congratulations, but just book 1 seat for me. I'm coming there.
So thank you, everyone. With this note, we will close the 95th session. We are meeting every week on Saturday. This was the 95th session. We'll meet again next week, same time, same day. With this note, thank you so much for joining in. Stay tuned.